X-ray, and I also had the Remedi from Korea, because we also got this. So this is what I'm talking about, the collective effort to actually try to get TB. So we also had molecular testing right there and then. So when the cases we found that had the radiologic evidence, we immediately put them on testing, and those that were positive were put on treatment. So it's really made a big difference. Korea donated. Of course, the TB Reach was started by USAID together with Japan's Fujifilm, and it was fantastic. A backpack, you can go anywhere. I've seen this. We put it in open areas. You saw the pictures of Tahoe. That's in Cebu. That's in our central island in the Philippines. You see a tent with a X-ray and a laptop and plastic chairs, and people line up. It's amazing. It's technology that we didn't have before, and we were detecting asymptomatic TB. Apparently, in the Philippines, because of stigma, there is still a lot of people who say, I don't have TB, I don't have cough. They will not go. But this is why it's spreading. I agree with my colleague from India. We need to detect the asymptomatic TB cases. And this portable X-ray with digital AI, you're right, the radiologists don't like them. Because we start treatment. But by the way, the radiologist discovered something. In the Philippines, we also have paragonamiasis. It's a flu, it's a lung flu. And it causes chronic granulomatous infection, exactly like TB. And they told me, Ted, they're diagnosing them as TB. They put them on treatment, they don't get better. Then they declare them as multiple drug-resistant TB. But when you do the test, it turns out to be lung flu. So again, we're learning about these things because lung flu are specific in some islands. So there's also chronic granulomatous disease that can mimic TB, and TB can mimic other things as well. So we're learning a lot. Korea recently donated eight Remedi machines. This is Remedi is like, and they're giving me another $10 million. So let's go to the story of technology. So when I came in, I was the Minister of Health post-COVID. And luckily, we were working with the World Bank. The World Bank offered to help me with the problem of gap in surveillance and testing for diseases like COVID-19 or a pandemic. So we worked on a loan. I got $400 million for the next 4 years. And the idea was to build 250 health centers that is digital. That means I have digital X-ray, I have digital molecular testing and surveillance connected to a control room and digital, like a NASA control room. So I can have the GIS, the one that Sao has been showing, be able to where the hotspots, show where the hotspots are, and be able to have targeted approach to eradicate TB. But this is where we are now. We've just signed the contract, and I think this will be a successful way to eliminate this very high incidence in TB. So it's really a game changer for me. The radiologists, we still need them. I think for the false positives, I think we still need the help of all the other. So I tell people, yes, AI and digital health will be a game changer, but they are tools. Healthcare is still about how people help diagnose and help people. So for me, these are your tools. The same way our writer would use a computer to write a book. But again, it's the writer's brain that actually makes the books and matches the words. So it's the same for us. Our idea of eradicating TB is not to replace the doctors with digital technology, but to use the tools to be better doctors and treat our patients better. Thank you.
Thank you.